Hello, everybody. It's hump day. Yeah. You made it halfway through the week. I hope it's been a great week for you. I hope that things are going okay and that you're doing well and that you're going home happy at the end of the day, feeling proud of what you did. Because honestly, guys, I'm really coming to believe that is, man, that's what it's all about. Vet medicine is always hard. We always have, we have a challenging job. And if it wasn't challenging, then everybody would do it. But it is challenging. And so only a special group of people get to do it, and that's us. And so I hope that you're going home at the end of the day feeling good about the work you did, because, man, that's what success looks like. Guys, real quick, I am about to bring on one of my friends. We're going to talk some behavior today. And it's going to be a good conversation. It's short. I'm going to get you some pearls, some low stress handling pearls, some conversation pearls, and we're going to get right into it. But while people sort of file in, go ahead. Let me know. Let me know where you're watching from in the comments, and then let me know what your role is. Are you a veterinarian? Are you a veterinary technician / nurse? Are you an assistant? Are you front desk? Are you managing people? Are you grooming? Are you breeding? Everybody's welcome. You're all welcome to be here. And I just like to know who we're talking to so that we can do the best job for you possible. So guys, come on in and let me know what's up. Thank you. Thank you. Good. Getting some good comments. Welcome. Welcome. All right. Got some veterinarians in the house. Awesome. Great. Guys. All right, cool. Well, welcome. Welcome. I want to go ahead and bring on my guest today. And as I do on these Facebook Lives, if you have any questions for us, put them in the chat. Put them in the chat, and we will try to take them. Dr. Schweitzer, welcome, welcome. Dr. Foote, we have a veterinarian who lives behavior, he says. So I am super thrilled. Guys, bringing on my friend, Dr. Sally Foote. Welcome, welcome, Dr. Foote.
Hi. Thank you for having me on today, Andy. This is exciting.
Oh, my pleasure. So for those of you who don't know Dr. Foote, she is a veterinarian who eats, breathes, and sleeps animal behavior, and especially low stress handling. She is someone who does about as much as anybody as far as training veterinary teams on low stress handling. And so if that's something that you're looking for in your practice, Dr. Foote is a fantastic choice. She has a huge library. She's really easy to find online. And she does great stuff. And Dr. Foote was actually visiting the practice where I work, Travelers Rest Animal Hospital, recently. And she was doing her top 5 low stress handling techniques talk. And so that's when I got to catch up with her. And she got a question from our team. And it was, what do you do when you have a pet that you think needs to be muzzled, or especially if you're getting ready to do something that might be potentially painful for them, like abscess anal gland, stuff like that. Toenail removal when you got a cracked nail, anything that you go, this is going to hurt, and we should have a muzzle for this. And the pet owner doesn't want you to do it. What do you do? And I thought this would be a really good, I think it's a very common question. I think a lot of people worry about, like, what happens if I say that we're going to muzzle and the pet owner's not into it? What do you do? So that's what we're going to talk about today. So any questions you guys have, go ahead and throw them up, and I'll try to take some of them as we go. But let me just start off this. Dr. Foote, would you talk a bit about just muzzling dogs? I love hearing you talk about it. It's something that we do it all the time. We take it for granted. Walk me through the best way to use a muzzle in practice, if you don't mind.
Okay, thanks. So first of all, the need to muzzle a dog is something we do need to do from time to time, even in the nicest, sweetest, most gentle, cooperative patient, because pain triggered aggression. In other words, when the dog is in pain, the pain is going to have them trigger up to head flip. Remember, my little stuffed dog. Say I go to raise the tail where there's a sore anal gland. It's normal for the head to flip quickly in an attempt to bite. Oftentimes they are not growling, they're not staring. You don't get that slow escalation. You get the quick boom. And who's going to get it, right? It's going to be the assistant who might be restraining the animal, or maybe me. Now, I can give pre-medication, etc., to try to reduce this anticipated level of pain. But I won't know really the level of pain until the moment when I go to handle the rear end, right, raise the tail. And in that moment, he may flip his head because it's intense pain, right? So I've got to keep the mouth protected, meaning we're going to use a muzzle, because we have a lot of PTSD in our profession, both from the veterinarian and the assistant technician, from bites, especially facial bites. And this is when these facial bites happen. So my top 5 low stress handling techniques, I have a video on my YouTube channel. Take my course, you can see it. It's basically, you take the yummiest food, like the squeezed cheese, put it in the front of the muzzle. And if the animal's never been muzzled, they will voluntarily put their face in the muzzle. And that is what's so important. Before they're agitated, before I've triggered the pain, or we've triggered, the anxiety and the pain, he eats out of the front of the muzzle a little bit. Oh, now you know where it is. Reload it up, put it the correct way. And he wants to put his face in, put it on, and he's continually fed throughout the process of where now I've got to check the bottom out, put on the lidocaine cream, whatever. So he is getting that positive reinforcement, and we're protected, because he may still do a quick head flip.
Yeah.
So that's the concept. And then we've got, the problem is muzzling has typically been done when the dog is already agitated, growling, snarling, and lunging. So muzzle equal means dog, mean dog. And we have to change the meaning of the muzzle, as well as acknowledge, just like a carpenter now is going to wear safety goggles and hearing protection. 4 years ago, they didn't. But they do now because of all the injuries, and it's acknowledging, no matter how good you think you are around that, table saw, that blade's got to be on, because you don't know what that wood might do.
No, and I think that's a great point. And let's be kind to ourselves, and sort of say, I think a lot of us, we assume the best and we want the best. And I think a lot of us in the past we've tried to minimize the use of muzzles, thinking that they may add stress. And so we don't end up getting them out until we've seen that reactive behavior. We've already got an amped up dog. And now we're trying to walk them back down, and we go, oh, well, now they don't want treats. Well, no, they're already in this fight or flight mode, high heart rate, muscle tension, and all of those sorts of things. Let me ask you this. So Lindsay says, what is your specific language or wording when talking to telling their clients their pet needs to be muzzled? And so I'll start with so you go first, and then I'll do mine.
You'll jump in. Okay. My techs had a wonderful way of saying, we've got a party hat for him. We got a feed bag for him. This was never called a muzzle. They'd bring it out before any behavior. They already knew. We already, think of it like a decision tree. Anal gland abscess, eye problem, ear infection, nail problem, potentially painful exam, or animal in some level of pain. We're going to get out the party hat. Now, so first of all, the terminology was not the word muzzle. Okay, we softened it up. Secondly, especially, they would not necessarily muzzle up the dog before I walked in the room, but they were already warming the client up to it. Second thing they would do is say, let me show you how we make this fun. And they would use the word fun. So they would also say, we're only using the best stuff in this. They get the platinum reward. They get the highest paycheck from this. Do not use squeezed cheese for everything. Save it for the toughest stuff. So then they'd line a little bit of this, and as they might talk to the client, they would just either hold it out for the animal or lay it on the ground for the animal to clean it up. And oftentimes that would be a big icebreaker for the client. It's like, oh my gosh, he likes it. Yeah. It's no different than a horse feed bag. Yeah.
No, I agree with that. So I love that wording. I love talking about here's how we make it fun, all those sorts of things. Getting the muzzle out early on before it's like, oh, your dog has tried to bite and now he's getting muzzled, because that feels so shameful for the pet owner, right? And so this is one of those things where going earlier just is so much easier. The other big things that I really lean into when talking about muzzles, for example, is so this is a little behavioral psychology, social proof. I don't want people to think your dog is the only dog I'm going to see today that's going to wear a muzzle.
Okay.
You know what I mean? And so just normalizing of this is what we do when we have ouchie under the tail stuff. We put on a party hat, we put on nose warmer, we put on we do a lot of treats, and we move slow and carefully and work to minimize pain. And that's what we do. And then it's not what you don't want to set up is this idea of, I think your dog needs a muzzle. It's like, no, this is what we do. This is how we do it here, and I'm really almost putting it on, this is our policy. This is our procedure. This is what everyone does. And so that, to me, that's a really that's a really big one. That just sort of takes the stakes down. I don't want them to feel that their pet is being judged. I really like talking about this is how we do this procedure.
Yeah, and the other like statement I would make, and my text would maybe word it slightly differently, would be, it's normal for him to try to bite when he hurts. It's normal.
Yeah.
And we got to get the pain meds in now. So this is why we're going to use the muzzle, because he may try to bite because he should. That's normal behavior. It's not a problem. That's a little wordy. Sometimes I just say, you know, God gave them teeth and they're not just for eating. Their mom taught them how to use their teeth when they were in pain or they felt threatened. He's in pain right now.
Yeah.
So we need to just be protected, and we're going to make protection fun. So those are some of the statements, if that helps the listener out.
Oh, I love it. I think that's fantastic. There's a little bit of a argument inside vet medicine about muzzle being a dirty word. And I think the distinction that I like to make is I say muzzle should not be a dirty word. It's not a bad thing. And so we as vet professionals should use the word muzzle. We should be fine about a muzzle. We should normalize muzzling. I still think that we're only touching pet owners once a year or twice a year. And to them, they have 30 years of muzzle being a bad thing or a scary thing kind of in their mind. Yes. And so while I agree, we should talk more about muzzles. We should be open with muzzles. Muzzles are not a bad thing. We should not act like that. I don't have any problem using terms like party hat, puppy face mask, nose warmer. I like them because I see an immediate response with pet owners. And again, every pet owner is different. And some pet owners are already, sometimes I have pet owners that come with their own muzzles. They're like, man, I brought his muzzle. You're going to want it. And I go, thank you. Like, exactly. Let's work together and you can go ahead and put it on and we'll do some treats and, and we'll incorporate you into this. And so they're all at different places, but just because I think that muzzle should be normalized doesn't mean I'm necessarily going to use that term with the pet owner, because I'm in a different place than they are. And so I'm going to try to meet them where they are to make them feel okay.
Yes. Yeah. I think that I like how you say meeting clients where they are, and it's a balance. It's a balance of, okay, I understand, client, you feel I'm making a judgment on your pet. Oh, he won't bite. He's always good. What are you afraid of my dog? Okay, these are the statements clients might make back as we say, okay, before we get started, we're going to have him wear this muzzle and he's going to be happy wearing it because he's fed through it. And then these comments come out. And then my response would be, yeah, in the past, you probably saw a muzzle used when an animal was aggressive, lunging, biting, and 3 people held him down while everything was done. That's not how we do it here.
Right.
So I'm kind of making an assumption about the past experience that is bringing forth these comments, yet I'm going to be right 90% of the time, and I'm also putting it out there. That was the old way. Here's the new way.
Oh, and I love that because I'm not telling them that they're wrong or that what they thought in the past, or I'm not invalidating their previous experiences.
Right.
I'm saying, that is how we did it for a long time.
Right.
And what we've learned is this, and this is what why we've made the change is this. And then they're like, oh, I was right.
Yes, it's right.
And now I'm going to be right again. So I love that. There's great stuff in the comments. Amanda says, telling folks that my goal is to go home with all of my appendages and body parts that I came with. Making a joke like that, read the client. But if you can make a joke, if you can make it laugh, if you can make them laugh, and again, anything that takes it away from, I'm sorry, but your dog is going to go onto our muzzle list and they will be flagged as a potential danger from now on. Like, no, like, hey, I've only got 10 fingers and toes and I have to see pets all day long. And so we're just going to wear muzzle. I think stuff like that is great. And then Kelsey Carpenter says what I say, my dog gets muzzled. Yes. For those of you who know Skipper Roark, he's not a good dog. Like we're tight, but he's not good. He lives his truth, and it might not involve you messing with his tail. But I know that, and that also just helps them feel more normal. Say, hey, this is what I do with my dog, and this is why. And so it really takes away that shame aspect, I think.
Yes, yeah, shame is a big element in here. I think shame is what's behind that emotion of, no, he's fine, right? And in my puppy classes and my puppy behavior certification course, I, as part of the curriculum, say, we're going to practice muzzling puppies. We're going to practice putting puppies in stainless steel cages at the vet office, etc. Muzzling with treats. Why? Because at some point in this dog's life, He may have a corneal ulcer. He may have an infected ear. He may have that torn toenail. He may have that abscessed anal gland. He may have been hit by a car, right?
Yeah.
And come in highly injured. So in order to get the pain relief meds in them, we're going to need to do a quick muzzle so we're safe, because it's normal for him to try to bite us. And as a puppy, if they've seen this already once, they're socialized to it to some level. And it really decreases then any resistance from the dog.
Yeah, there's a great question here from Jessica that I want to give to you. She says, what about those pets who have previous PTSD from muzzling, or probably from experiences while being muzzled, like snapping and biting at the muzzle? So these dogs, they see the muzzle, they don't like it, they're negative to it right off the bat. She says, can you require that pet to come in muzzled? Recommended behavior, muzzle training. Let me just turn it over to you like that and sort of say, I have a dog. And they don't like the muzzle. They know the muzzle. They are aggressive towards the muzzle right away. What do I do with this dog? Help me help this pet.
Okay, so to start with, if that dog is already aggressive about the muzzle, he will never be counter conditioned or desensitized to the muzzle quickly. So you need to learn advanced low stress handling techniques for other techniques called hooding, which is the way we throw a sleeping bag over their head for an intramuscular, say, injection to get them sedate. Even Elizabethan collars may work, but it depends on how well that dog will accept the Elizabethan collar.
Mm-hmm.
So typically the animal needs to be hooded and removed and just put completely out in that case. I had a dog like that. I had a German Shepherd that was hospitalized at a specialty clinic, and because of his aggression was constantly muzzled. When this dog saw a muzzle now, he literally wanted to kill the muzzle.
Yeah. Yeah. So another really great one. What do you say when clients say, we don't need that, we can help restrain, or when they want to be inserted into that situation, especially if it's something that's painful? How do you take that? And let's think about some specific wording.
Frankly, I take a very hard line. I just say no muzzle, no care.
Yeah. So,
no.
Okay.
He'll bite you. I can't control that. No muzzle, no care.
Yeah.
And I may walk out of the room and just say, you think about it. I've got other things to do. All right.
Yeah. I'm with you. So I am 100% with you. And I'm glad that you say this. Guys, I think this is serious. I don't know when we decided that the whims of the pet owner were more important than the safety of our staff and ourselves. But that's a mistake. That's not true. And that's not going to be true if you work with me. But yeah, and I don't think we have to be jerks about it. I'm not going to be, how dare you ask if you can hold it? No, I'm not saying that. But This is a hard line of, I need this pet to be muzzled so that I feel safe. And that's what it's going to be. Period. And if they want to go somewhere else, guys, we've all got more business than we can do. We've all, if they want to go to another veterinarian who feels comfortable and safe, you know what? I'm fine with that. And in no heart, I'm not going to stay awake and stew and go, how dare you go somewhere else? No, you should go somewhere else. And I hope that they're happy to have you and that you're happy to have them. And maybe that person is a perfect fit for your pet and your pet will be great with them. That's awesome. That's not me. And that's not what I'm going to do here. And I'm not going to get bitten, and I'm not going to let my technician get bitten. It's just not going to happen. And so I really do think that for me, those are the types of personal boundaries that we have maybe not kept in the past. And it's just common sense now. Our staff matters, and they matter more than our clients do, quite honestly. They do. I'm sorry. Like, I'm going to take care of the staff because the staff will take care of the clients. And if the client wants to leave, that's fine. I'd much rather have a client leave than my staff member leave.
That's true. That's true. Yeah. And if one, like as you said, you like to keep all your fingers and toes. Another way to kind of flip that comment is the average educational cost in state of a veterinarian is at least $350,000. One veterinarian with a facial bite or a bad bite to the arm or hand, they're out of commission.
Yeah.
What has that practice lost? No, we can't afford to lose that. And then secondly, a veterinary technician, a certified or credentialized, licensed veterinary nurse / technician, that cost may be as high as $50,000.
Yeah.
And we have a hard time replacing them. So no, I am not going to put that person in that risk and lose everything else for the practice.
Yeah. I like wording from Kelsey Beth Carpenter. And I use this one a lot as well, as I will say to the pet owner, I want you to be visible. You know, I want you to be up front where they can see you. Ideally, you're the one giving the treats.
Right.
You know, if I can set those things up, and I just really lean into the value of, no, I don't want you holding and being the bad guy. Quote, the bad guy. But I'm, you know, I want you to be in this supportive role that also happens to be a safe role and also happens to be out of our way if things go a little sideways and we, you know, and we need to move quickly and adjust and things like that.
Yeah, I think, Andy, some things that you brought up, and myself too, is that being very direct, direct language, specifically tell the client what you want them to do and what you're not going to allow them to do. And you do it all in kind phrasing, like stand here and you're the cookie king. Stand there and you're the cookie queen. Sing happy birthday to them while I do this because they love the sound of your voice. Then that's how you can nicely say, no, you can't hold them, but you can do this and you're a part of making it better for them.
Yeah. There's one question that's come up twice in the comments, and I want to take it, and then I think we're probably going to be out of time. Any advice on using muzzles during euthanasia? Does that differ at all for you as far as presenting them if you're concerned about biting, you have a painful pet, things like that?
Not at all. I use them all the time, especially in a behavioral euthanasia, you know, that we have to euthanize because of aggression, or that, you know, again, hit by a car, extremely traumatic patient that may be, you know, in a lot of pain, and we've used that for controlling the face. I always do what I call a staged euthanasia, meaning whether they come in already orally pre-medded with like a 4-part cocktail so that they're a stumbling drunk, as I say, to come in the door. Then when we give an intramuscular injection, that they are out to an anesthetic plane. But that muzzle, frankly, on behavior euthanasias, I'm never taking it off till they've passed from this world.
Yeah.
And I've told the client again, and most of these clients understand the need for it, but it's also the same caveats that he may react quickly. I can't control that. Also, this process of, but if we've made this nice, this is not an element of stress for them.
Yeah. I love it. Dr. Foote, thank you so much for being here. I'll put a link to your Facebook page or to your website down in the comments below so people can find it. Do you have any parting words, any final thoughts before I let you go and enjoy the rest of your day?
Yeah, well, first of all, thank you for this time, Andy. It's been wonderful. Secondly, I really want us all to embrace that we can't always make it nice for the patient, for the pet. There are times when, yes, we're going to have to do some exams that are going to be in a state or a level of some amount of pain or some amount of anxiety, no matter how good we are at our low stress handling, fear-free techniques, pre-medication, etc. And for that reason, we use and need to use safety tools, and we make them fun. Things like muzzles, the handling gloves by Armor Handling Gloves by Dr. Laura Catena. I have videos showing how I've got cats eating baby food off of that. But that it is not a job requirement to take the hit, meaning the bite or the scratch, to spare the feelings of the client.
Yep. I agree. We've got to do this job for 10, 20, 30 years. I'm tired of techs and doctors leaving the field after a couple of years because they're broken and they're beaten up and they're tired. And it's like, we're not doing that anymore, and we shouldn't do that anymore. So again, I love that you say, I've been a big believer recently thinking about the difference in being nice and being kind. And I think a lot of us are just nice. And so when people ask us, we say yes because we're nice. And I go, you know what? I think we should focus less on being nice and more on being kind. And being kind, it means being kind to ourselves and being kind to the pet and being kind to the owner, all in balance. And that means no. I'm not going to have you holding this pet, and no, we're not going to go forward without a muzzle. It's just not going to be possible. All right, guys, have a wonderful Wednesday. Thanks again, Dr. Foote. You guys take care, be well, take care of yourselves, and look out for each other. I'll see you guys later on. Have a good week.
Bye-bye.